Does India really have the lowest cancer incidence in the world? When you hear the words lowest incidence of cancer in India, it sounds unusual to say the least. However, a 2018 study by the Institute of Health Metrics and Evaluation, Washington University, concluded the same. According to it, in 2016, India witnessed 106.6 new cases for every 100,000 people. It further ranked 10th among the countries with the lowest incidence of cancer. Now, this is comforting to hear, especially with all the growing instances of cancer one might have stumbled across in our day-to-day lives. However, is this really what it sounds like? India's mortality rate. Dr. Jaskaran Singh Sethi, Director and HOD Radiation Oncology, Fortis Hospital, Shalimar Bagh, navigates between these stats in the following manner. One needs to understand that there are different types of rates. There is an incidence rate, a mortality rate. All these are ratios relative to each other. An incidence rate is the number of freshly reported cases. While the rate of incidence is low in India, the number is very high because the population of India is so large. Dr. Jaskaran Singh Sethi. While the incidence might be low, the number of people who are diagnosed with it is still disturbing. For instance, this report points out that 39 lakh cancer cases were registered in India in 2016, according to the National Cancer Registry data. Add to all of this the fact that the cancer burden doubled in India between 1992 to 2018, according to another report. Dr. Rakesh Chopra, Director, Medical Oncology, Hematology and Bone Marrow Transplant, Akash Healthcare Super Specialty Hospital, comments on the high mortality rate in India and says, "Our mortality rate when compared to the Western world is higher by at least 20 to 30% as compared to African and Central Asian countries. On the other hand, India is lower by 10 to 15% as compared to Southeast Asia, worse than some nations but better than others. Low rate of diagnosis and lack of awareness. Factors like the current healthcare facilities, the abysmal number of diagnoses for every cancer patient, the financial requirements and the paying power of an average Indian all show that irrespective of the rate of incidence, the mortality rate is still at par with those parts of the world where the incidence might be high, as Dr. Sethi mentioned." He further comments on the same and says, "Data computation of cancer patients in India is done through the Indian Council of Medical Research. There are two registries at play in India when it comes to registering cancer patients, hospital-based and population-based. However, many patients are uncaptured because of the methodologies involved in acquiring data. Many patients are diagnosed and are not seeking treatment from the nearest cancer centers. In India, 3/4 of the patients are diagnosed in the third and the fourth stages of cancer. Abroad, 1/4 are found in the third and the fourth stages of cancer. This can be attributed to the fact that there is lack of basic public health awareness and education." Cancer diagnosis in India. When it comes to diagnosis of the disease, the list of obstacles goes on and on. Lack of screening camps, awareness, public health facilities, machinery, treatment options, access to primary medical help are some of the gaps in our cancer delivery treatment. Dr. Jaskaran Singh Sethi. The situation is far worse in rural India, where several cancer patients might not even be aware that they are living with the disease. The facilities for cancer diagnosis are not available in the rural belt. If a patient has cancer in rural India, going for treatment will be difficult because the nearest hospital will be a few hundred kilometers away. Even then, once they reach, it is not necessary that the hospital will have all the necessary machinery for treatment. Radiation machine might not be there, chemo treatment might not be possible. Dr. Jaskaran Singh Sethi. Further on, things seems even more bleak. Tier 2 and Tier 3 cities have this issue, lack of facilities and manpower. Dedicated cancer wings and radiation wings are often not within reach financially or physically for most of the Indian population. Dr. Jaskaran Singh Sethi. Bad healthcare facilities is definitely an obstacle in ensuring treatment of the disease. Dr. Chopra adds on this context, "It definitely has a role to play in the outcomes, costs of therapies, time lost in mortalities and higher mortalities. Stage 1 becomes stage 4 due to ignorance of patients and caregivers. Burden on the cancer delivery system institutions and the everyday questions at their places." Dr. Rakesh Chopra. Most common cancers in India. When it comes to men, cancers of the head and neck along with lungs, prostate and colorectal are most common, according to Dr. Sethi. For women, it is breast, gallbladder and cervical. Malignancies like blood cancer affect both populations. While there is no specific age group in which cancer strikes, it is more prevalent amongst the elderly. He further adds, In recent times, however, cases in children and youngsters are also rising, Dr. Jaskaran Singh Sethi. Partly in agreement with Dr. Sethi, here's another report that suggests that the most instances of cancer are found among the elderly and women during their reproductive years. According to Dr. Chopra, tobacco-related cancer, infected agents-related cancer, hereditary cancer are the common kinds of cancer in India. He further adds that there is a difference between urban and rural-based cancers as well. How has India's approach to cancer changed over the years? The first significant change is the manner in which we view the disease. Conversation towards reducing stigma has increased to assure someone struggling with it that treatment is possible and that cancer is not a death sentence. Dr. Sethi adds to it and says, cancer treatment in India has flourished with experts coming in. The latest technology and machinery, treatments, research is underway on a large scale. People are more willing to come forward and get treatment, get diagnosed, and there are facilities and treatments for the same. However, this comes with a reminder that though the rate of mortality is dropping, the numbers are still large because of India's population. Healthcare facilities for all still remains a distant dream. In case you want to go down the prevention is better than cure route, the doctor's advice is simple. Control your intake of alcohol and processed food. Smoking should be avoided at all costs. It is the single highest risk factor for cancer. Obesity should be tackled as it can be the harbinger of cancer troubles. Exercise is important for a strong immune system, Dr. Jaskaran Singh Sethi. Dr. Chopra agrees that regular screenings, checkups, and awareness of early signs of cancer is the key.